I think that documentary is really going to do some good things. Like, did you know that the Black Americans are at a higher risk of developing heart failure at an earlier age and are at increased risk of hospitalization for heart failure compared to white Americans? The disparities that persist are based on ethnicity. So I spoke to Dr. Ashkan Hayatdavoudo. He's the co-founder and chief medical officer of Presidium, a healthcare corporation. Check out what he had to say. Hi, Ashkan. Thank you so much for being here.
Hi, Ashley. Pleasure. Thank you for having me on.
Oh, no problem. Now, please tell me, what is heart failure and why is it so important for us to talk about? Is it just the failing of the heart, or are there other things that we should know?
That's a great question. Yeah, it's a very scary phrase, heart failure. What it really is a long-standing progressive condition that affects either the structure or function of the heart, and ultimately what it leads to is a diminished ability of the heart to do its primary function, i.e. pump blood to the rest of the body. And it could present itself in a multitude of ways, um, from a mild cough on one end of the spectrum to severe shortness of breath on the other end of the spectrum. And the reason why it's so important to talk about heart failure in the context of minorities, not only because it's Minority Health Month, but specifically, Black Americans are a high-risk group as it relates to heart failure. They are at higher risk of developing heart failure, they develop heart failure earlier, and they have worse outcomes with their heart failure than their white counterparts.
Now, how can we manage heart failure if we, happen to come across it in our own lives?
Like most things, heart failure is pretty individualized. However, there are bedrocks that we can all follow. I think all of us have been to the doctor and have had the doctor tell us to decrease our salt intake or increase our activity. These are also cornerstones in the management of heart failure. The third cornerstone is taking medications as prescribed by your doctor. Specifically, I'm here with Novartis to raise awareness of disparities in healthcare, and as it applies to this instance, within heart failure management. That includes medications. Entresto is a medication prescribed to adults with long-standing heart failure that reduces the risk of hospitalizations and death as a result of heart failure. With that said, with those outcomes, you may be asking yourself, why isn't everybody with heart failure on it? And that's because, again, heart failure is very individualized. So the main takeaway should be that your listeners should have a provider that they feel comfortable communicating with, sharing their symptoms with, and developing a management plan that's individualized for them. Because what's for one person might not be for all people. For instance, Entresto isn't for everybody, like any medication. Pregnant patients, patients on ACE inhibitors or ARBs, patients who've had prior swelling called angioedema in relation to ACE inhibitors and ARBs, this medication wouldn't be appropriate for. And all that is to say that the primary takeaway is to establish a connection with a doctor that you're comfortable with and have her manage these symptoms and your various conditions with you in an individualized plan that's for you.
Yeah, and I love that you say that, because it being Minority Health Month, I think the conversation, thank goodness, has started to build around minorities, especially demanding better health care and not leaving that hospital until you get what you believe that you came in for, or what you deserve, and running this test and that test. So I think it's really important that you say that, and finding a healthcare provider that you trust and that will, obviously take your pain and your concerns really seriously.
You're absolutely right. And in our part, healthcare providers need to step up, realize that there is implicit biases from within our practice and be able to be conscious of those and mitigate them. I would like to share for your listeners out there that would want additional information or to review some of the information that we shared on heart failure. Entresto.com is a great resource. It has a lot of information on heart failure, what to do, what it is, what to ask your doctor, etc. So for those that are interested, please feel free to visit. We encourage it.
Absolutely. Thank you so much. And thank you so much for being here. I really enjoyed this conversation. I think it's one that is very important and one that we need to start having more often. Thank you so much.
Thank you. I agree. And I thank you for allowing us to participate in this quest of raising awareness.
Absolutely.